introduce myself. My name is Martina Harkin Kelly, and I am the president of the Irish Nurses and Midwives organisation. As I drove up this morning from North County Sligo, I listened to many songs along the way. But I have to say the one song that stuck in my head was Bread and Roses. And the very first two lines of the first verse of that song, which has come from the 1912 strikes in St. Lawrence in the USA, where women bemoaned their conditions and men of work. Those first two lines state, "We go marching, marching. We are here to stay, and we always want to have good conditions of pay." Now that is vitally important, and I say it once and for all. I also have to say what a heartfelt and humble thank you to all of you who have supported the Nurses and Midwives of Ireland over the last number of weeks. And I say thanks to the friends, the families, the patients and the supporters. It's an immense and really humbling sight today to see the many thousands that are here gathered. And I sincerely hope that unlike the Trump campaign on the day of his inauguration, that the media reports the numbers correctly. For all of you, I am a nurse myself for 36 years. This is my second strike, which I have to say is an indictment on any society and on any governing organisations. To think that when I started nursing in 1983, there were the cutbacks, there were the exoduses of nurses in the 80s and the 90s. We did enjoy a little period, albeit brief, of somewhat of a boom. However, that boom soon became a bang. And for us as nurses and midwives, not just did our core pay get hit, but also they stripped us of any allowances and any extra pay that we had. I have to say, every nurse and midwife, and indeed those members of the psychiatric nurses that are here, every single one of us, has at least a certificate, a diploma, a degree, a higher diploma, a master's, and some have PhDs. I am, and I have been for a number of years, an educationalist. I'm a strong northern woman, and I don't take no for an answer. I sincerely hope that if the government are listening to this slua at our Crinia here in Youth, that they will listen and listen carefully and ensure that they engage, or as our Taoiseach said last night, that it is warm at the very least and productive. So therefore, I will hand you over now to Mr. Peter Hughes, the GenSec of the Psychiatric Nurses Association. But before I do that, I want to sincerely thank the band and the pipers from the fire brigade who have supported us. I nearly felt like taking the dancing shoes out because I danced until I was 17, but I'll hold that off until I see what proposals we get. I'd now like to introduce Mr. Peter Hughes, the GenSec of the Psychiatric Nurses Association.
Good afternoon. What a fantastic crowd. To you, to the many families and friends of nurses, and to many members of the public that we knew are here today to show their support and solidarity with our nurses, I want to say a big thank you. If the government and Minister Harris had any doubt about our resolve and determination to see this campaign through and to solve the recruitment and retention crisis in Irish nursing once and for all, then they are getting their answer here today. Each and every nurse here today knows the extent of the recruitment and retention crisis. It is not some rhetoric or slogan, but a stark reality that we live in with every day in all areas of nursing: general, care of the elderly, intellectual disability, midwifery and mental health. In mental health, we have watched as the crisis has grown and deepened to a point that it impacts on every area of already underdeveloped and struggling mental health services. We have the strategies and the plans for how our mental health services should be developed and delivered. We have dedicated, committed and highly trained staff and graduates who want to deliver the professional nursing care that they train for. But all of this counts for nothing while we have a recruitment and retention crisis at the heart of our mental health services. This crisis is impacting daily on the quality of care and the access to services for patients and service users. It is holding back the development of services at hospital and community level in every part of the country. It is denying our children and teenagers access to child and adolescent mental health services. It is eating away at the morale of nurses who every day work in mental health services that are short of staff and are held together with a patchwork of goodwill, agency and overtime. It is driving highly trained and ambitious graduate psychiatric nurses out of the country to better paid jobs in properly staffed health services in the UK, Australia, Canada and the Middle East. The recruitment and retention crisis is wasting money as we patch our rosters together with expensive agency and overtime, rather than investing those resources to properly address the issues at the heart of this crisis.
Hear, hear!
Colleagues, I have said we have watched this crisis steadily worsen, while at the same time the government has stuck to its tired old mantra: crisis, what crisis? In November 2017, we warned we had 500 vacancies in our mental health services. By last August, that figure had increased by an astonishing 40% to 700 vacancies. And we already know that by 2021, 34% of psychiatric nurses are eligible to retire. That's 1/3 of our nursing workforce. For nurses dedicated to patient care, the implementation of our overtime ban has been difficult. However, that 5-day ban demonstrated beyond doubt the unsustainable reliance that our mental health services have on overtime to hold them together. Last week, we saw across the country how our services struggled when they didn't have the safety net of overtime, with nurses unable to leave their shift as there was no nurse to replace them. Minister Harris, we cannot continue to fill the gaps in our mental health services with overtime and agency staff, nor do we want to. We cannot continue to say to the most vulnerable in our society that they cannot rely on the continuity of care in the delivery of mental health services, because we simply cannot recruit and retain nurses into those services. We want to recruit and retain our young, intelligent, professional graduates, held in the highest regard throughout the world, so that we can provide a comprehensive, consistent service. This is the least that our patients and their families deserve. government policy on the future of mental health services was launched in 2006. 13 years later, what has this delivered? Yes, this has closed the institutional model of care. Yes, the walls have come down. Yes, 76% of beds have been removed from the services. However, the promised community care has never materialised. Instead, what have we? Overcrowding in our admission units, an increase in people with mental health problems in prisons, an increase in the homelessness of people with mental health problems. Only 50% of child and adolescent beds are operational. We have an astonishing 3,000 children waiting for a first-time assessment in the child and adolescent mental health services. This is a national disgrace. Our children are our future, and as the Constitution states, we must cherish the children of this country. This recruitment and retention crisis is not new. This crisis was inflamed by singling out nurses for a 20% pay cut in 2013. Nurses were the only graduates in that time to be treated that way. Overwhelmingly, our nurse graduates voted with their feet, emigrating to the UK, Canada, Australia, where they are more valued and you might even say more respected. Ironically, the government says that nurses cannot be singled out in relation to the current pay issue. However, they had no problem singling us out when it came to cutting our pay in 2013. The ill-fated Bring Them Home campaign in 2015 was a feeble attempt to bring our nurses home from the UK at a cost of hundreds of thousands. The result of that expensive exercise was the recruitment of the massive sum of 6 psychiatric nurses. What a waste! The PNA warned the government that this effort would fail, especially when so many graduates had left the country with a feeling that they had been treated with such disrespect. It was a feeling that was not going to be easy to reverse, as was showing over the last few weeks in the enormous support for our campaign from the Irish nurses abroad in Sydney, Melbourne, the UK, and all corners of the world. The government need to know that it is time to dispense with the rhetoric that nursing is a vocation.
Absolutely.
We are committed to our patients, committed to their well-being, committed to their safety, committed to their recovery. We are committed, dedicated, and highly trained professionals. We want to do our jobs with recognition, respect, and reward. And we certainly do not want the platitudes from a government that never tires of reminding us of how much they respect and value nurses. Respect and value does not pay bills. As we face into the next stage of our campaign, the time for platitudes is over. We've had the lectures from a chorus of ministers on the need for pay restraint and how everything other than pay can solve the recruitment and retention crisis. there is no problem with the budget in relation to bailing out the building of the Children's Hospital. Yet there is an issue with budget to pay nurses a decent salary. And I just want to say, the only way to resolve this crisis is to pay nurses a fair salary for the professionalism that they provide. Finally, fair pay will keep us here. Fair pay will make us stay. Fair pay will make us stay. Thank you.
Thank you very much, Peter. That was Peter Hughes, the General Secretary of the Psychiatric Nurses Association. I'm just looking down behind the crowd, and they are still coming all the way across. So we as nurses and midwives of this country, have sent a very loud and a very clear message to Dáil Éireann. And given that this is the year that they celebrate the centenary of the founding of this state, I think it's an indictment, given what our forefathers wrote, that they have allowed this to happen. I would also have to say, and before I preface the next speaker, the second verse of that Bread and Roses song that I spoke about said, "As we go marching, marching, we fight for all men." All I'd have to say is, those men are the citizens, the children, the frail elderly, and the people of this country. However, the men that we preface are the men and the women that have fought hard and sore to put this country back on its feet over the last 11 years of a recession.